Good Monday morning. It is October 11th. Welcome into the Morning Medical Update. We are live inside the Dolph Simons Family Broadcast Studio. Chief Medical Officer Dr. Steve Stites, right over here to my right.
Good morning.
Good morning. All right. We'll do a little Chiefs talk, get it out of our system here in just a
We're
moment.
But
we do have a good show today to take our minds off of it. Today we are talking about services, some fantastic services for those battling breast cancer. We're going to take you live inside Missy's boutique at our cancer center location over in Westwood. We're going to talk about the positive impact its services have on women and why it's simply necessary for cancer patients in our area. It's one-stop shopping, giving women a reason to smile and, of course, take their power back. But first, let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning to you.
Hi.
Hi. How are our numbers looking from over the weekend?
Yeah, they're pretty good. We were down to 13 active infections at one point this weekend. Right now we have 15 active infections with 6 in the ICU and 5 on the ventilator. Of those 15 active infections, only 1 is fully vaccinated. We still have 30 in that recovery period for a total of 45. And also Hays has 6 active patients and 7 recovery as well. So.
All right, thanks for that update. Do we have any
better numbers? They are better numbers, right?
I
We're down. I like the way that the acute patients are dropping so fast. It wasn't so long ago we were at 65 or 70 or 80 acutes, and now we're down to like 14 and 15. That's great news.
Good news. What are those new glasses? I'm just curious.
No, these are actually old glasses.
Okay.
These are the glasses I had on during the Super Bowl when we won. So I wore them yesterday and today.
Lucky glasses.
They
Or
were
not
my
so
working
lucky.
They didn't do well. I think we should talk a little bit about the Chiefs' health, because I believe that last year they somehow got irradiated with funny Super Bowl rays, and that they have, after the little of loss, they are essentially acting like they have post-COVID syndrome. That essentially they have long haul syndrome, because if you watch them, they look a little tired. They look like they have a little bit of brain fog. They just don't feel as good as they did, and they just appear out of sorts. And I think, Hawk, I believe this is really like a long haul syndrome.
Yeah.
I think they got Super Bowl long haul syndrome. It's just like COVID long haul syndrome. What do you think?
Yeah, I think it's a post-dual Super Bowl long haul syndrome.
Yeah,
sure.
I think it is.
New symptom.
Yeah,
Well,
I don't think they're
they'll
acute.
get over
I think
it.
it's chronic.
It just takes some time.
I
Yeah.
hope they get over it.
Yeah.
Did you stay up through the rain delay, the whole thing?
Of course. Yeah, I watched the whole game right down to the last second. I saw the four more turnovers. It's like, I believe the Chiefs are a little too giving right now. They keep having these games where they give a lot, and I don't like the gives. That's not a good plan.
No.
All right.
So
All right.
sports analysis in the morning medical update. The Chiefs have long haul syndrome from the Super Bowls. I believe that to be true.
Good Monday morning quarterback analysis from you two. Thank you
There
so
you go.
much.
We're
All
here
right.
for you.
Reporters on the line today. Yes.
Hi, good morning, guys. It's Taylor at 41.
Hey, Taylor.
Hey, Taylor.
Taylor, what'd you think about our Super Bowl analysis, our Chiefs long haul syndrome problem?
Well, being neither a doctor nor a coach, I don't know how qualified I am to. But I mean, it sounded right. But I'm
we're
not in the
completely
spot to
unqualified.
confirm or deny either of that.
100%
Qualifications
unqualified.
are irrelevant in this space, Taylor.
You were at the game and have a microphone, so you're more qualified than me. In
Yeah,
both of those
I was
aspects
actually
right
at my
now.
TV set last night. It was better.
Okay.
It wasn't wet. I was dry.
Have to ask about the Merck request this morning on the pills to fight COVID. I know we've talked about that whenever that news came out last week or the week before, but just knowing that might be another tool in the arsenal in the next possibly few weeks or months if it's approved, your thoughts on that request this morning?
Yeah, I think it's a game-changing deal, Hawk. I think that's a really big deal. It feels a little like Tamiflu for influenza. A 50% reduction in hospitalization and death is a big thing. It's not as effective as the infusion of monoclonal antibody therapy, but that's also laborious and expensive. It costs about $22,000 to $2,500, and this costs $700 for a course of therapy, which still seems a little high to me. But again, I don't set drug prices. And I don't call the place. And so I think the reality is it's an important adjunct to therapy. Remember that the studies were only done in unvaccinated patients. They weren't done in people who are vaccinated. So at the end of the day, if you can get vaccinated, then you don't need to be you may not even need the oral therapy, which would be a great win. So I am optimistic it's going to make a difference. I know there are a couple of other drugs that are oral therapies that we're going to hear about in the next few weeks as well. But I think it's an important adjunct in the treatment regimen that we've got for COVID-19, Hawk.
Yeah, I would just like to, we've seen the press release, would certainly like to see the data itself, especially the safety data. But just understand, this still is not going to take the place of the prevention, and the prevention is the vaccination. That is still going to reduce your risk of hospitalization, severe disease by anything. Because, of course, we have talked about this before. If you get the infection, you are rolling the dice, and you certainly are at risk of those outcomes. Now, your risk may shift and maybe decreased if you're doing some of these things like this possibly new oral pill, but I think it shouldn't take the place of the preventive measures of the vaccination.
And to say also that with this drug, it looks like there will be a pregnancy exclusion because of effects of unborn children, and so as a result, it will not be for pregnant moms. And we know that we've heard repeatedly, pregnant moms have some of the worst outcomes around COVID-19. So once again, another reason to clearly get vaccinated if you're pregnant or thinking about being pregnant. In this therapy, actually, you're supposed to not have intercourse for 4 days after you've had unprotected intercourse for 4 days after you've taken the pills, because there's such a high risk of teratogenicity, which means birth defects.
Other questions?
And a follow-up question to that. Yeah, just a follow-up question to that. If you could talk to us a little bit about the differences in medicine and therapy for, we talk so much about vaccine injections versus taking something for a pill. I guess the lay version of that question is, why isn't the same therapy not an injection at that point? Why a pill versus an injection?
Yeah, I think it just goes down to the drug finding process. And, once you do find a candidate drug from a selection of a lot of different compounds, then you get into start making it and producing that compound. What is the way that drug is going to be stable? Is it more stable in things like an IV solution, or can it be stable in a pill? And then if you do have it in a pill, are you able to take up that compound and get that into your bloodstream and get it to those tissues? So there is just a lot of details going into the development of these drugs on why some may be oral and some may be IV and what have you. And I think that's the main point there.
And I would say the oral pill, Hawkeye, is different in its mechanism, and you'll know more about this than I do, but the antibodies, if you think about the virus, it's got little, let's say, crowbars on it that allow it to pry open cells and go in and do damage. The antibodies cover up those crowbars. In this instance with the pill, what happens is it slows down the replication of the virus. It doesn't cover up the crowbars.
Yeah, you're still getting
Fancy medical term,
replication. This drug is getting inserted into those new copies of the virus that are being created in your cells, and when that drug gets inserted into the genome of those new viral copies, basically causes it just to mutate itself out, essentially. So it's taking place during the replication, whereas the antibodies more are getting intact virus that is out in your bloodstream. And then, of course, remdesivir is a separate type of mechanism, and that is the IV drug that we've been using for a long time here in the hospital. But it's a separate type of drug that just stops those new genomes or those new viruses from being able to be replicated to completion.
Would you like the term crowbars in medicine?
Yeah,
that's pretty good, I think, huh? Yeah, I got the Chiefs with Super Bowl COVID syndrome, and I got the virus with crowbars. It's a good Monday.
Things like I can understand. So
it's a Monday morning.
Speaking our language.
Yeah, after a loss.
Other questions? We are good. All right, we're going to get to community questions here in just a moment. We already have them coming in about the pills, so we'll talk more about that in just a moment. But the news that you have cancer, it is scary, it is emotional, and the cost of those treatments is pricey. A study published by American Health and Drug Benefits finds the average cost to a patient battling breast cancer nearly $86,000. It is certainly the last thing you want to think about or be burdened with while going through cancer. So it is places like Missy's Boutique at the University of Kansas Cancer Center that helps serve the underserved and provides comfort, dignity, support, friendship for women during this time. So Judy Newell is joining us live from Missys. She is the Appearance Center Manager and the powerhouse really behind this accredited boutique. So we're going to get to Judy here in just a moment. But before we go inside Missys, we want to introduce you to one woman. Her name is Lori Hartman, and she knows exactly how important these services are, and especially during a pandemic. Here's Petrania Poonswan with her story.
Did not see it coming. I have always been very vigilant in doing my annual well woman exams and mammograms.
It was during one of those routine mammograms when doctors noticed something wasn't right. A sonogram and a biopsy later revealed Lori had breast cancer.
For me, my personal experience was shock to begin with, which I'm sure is what most people have. And then after a couple of hours, it's like the words kind of resonated with me. And so at that point, I just kind of became calm with, okay, what do I need to do?
The 57-year-old mother and grandmother knew right then she was on a mission to get better. Over the next year, she underwent surgery, chemotherapy, and radiation treatments, and found support in places she never imagined.
I learned about Missy's Boutique in March of this year.
Missy's Boutique, located at the University of Kansas Cancer Center, offers tools and resources for cancer patients and survivors. Lori was able to get everything from a new bra in the retail space to a spot in an online class focused on renewing the body and spirit.
Not only did I meet some fantastic people, but I really learned quite a bit, some things that I didn't even know or that I didn't experience, but it also gave me a sense of normalcy on some things I did experience.
Lori is thankful for Missys and that she was able to get through most of her treatments before the height of the pandemic. Her goal now is to support others facing the same diagnosis. Her journey has changed her both physically and emotionally, but she's choosing to stay positive today and into the future.
It does afford you a little bit different outlook, not one that I would wish on anybody to learn it that way, but it is what it is, and we all just do our best every day and do the best with what we know at the time and keep moving forward.
Well, we are going to talk more about Lori's story here in just a minute, but Judy, thank you so much for being with us so early in the morning. How are you?
Hi, good morning to you, and thanks for inviting us.
Oh, you bet. Judy, we're going to dive in here in just a moment, but before we do that, I want to take a moment to introduce our audience to the Missys, the two beautiful women behind your mission. Your daughter-in-law, Missy Newell, and Missy Wilcox O'Neill. Both of these women courageously fought breast cancer. They lost their battle, but these two paintings actually hang inside Missy's Boutique, inspiring women to fight on and win. So, Judy, just take a minute just to tell us how Missy's came to be.
Yes, I would enjoy doing that. As you know, you see the pictures of the two girls. Those are our guardian angels here in Missy's Boutique. We started out about 12 years ago trying to create a one-stop shop for our patients. With the help of the Cancer Center and the families coming together, we was able to establish a legacy for these two women and all of our patients and survivors that come through our doors. We are so happy that the boutique has turned out to be such a success, and I'd like to give you a quick tour, if I may.
Yes, please do. And I know you have it decked out, fall and Chiefs. We need a little bit of that this morning. So, yeah,
Yes.
Please walk us around. Let us know what it's all about.
Okay, well, first of all, this is our retail center here. This is an important area because patients or survivors or people that come through our door, they feel comfortable. And that's our goal. We want them to feel welcome. The first room is our most emotional room, and this is our fitting room for wigs. We do head shavings, wig fittings. We do a lot of talking one-on-one with patients about the loss of the hair, what to expect, and we even have a nice flyer that is made and targeted just for chemo hair. A lot of places don't have that, but we are so proud that we was able to put that together for our patients. Now, the next room we're going into is our fitting room. This is where we fit breast forms, pocketed bras, post-surgical camisoles, anything that the script calls for. We have it in here. And so the rooms look small, but there's a lot of mighty things that go on in here. And just to give you an example of the warm fuzzy stuff here, we have purses of all kinds. We have fun bags. This is very popular here at Missy's with our patients, is our purses. And then we have a line of clothes. And then this area here is dedicated to breast cancer and other cancers. They're able to pick up tokens or pins or something that is directed towards that certain cancer type. And then, of course, we have the Chief's items here. These have been so hot, we're ordering them almost every other day and bringing them in. Hopefully, after this last game, that will still continue. And then we have our line of products here. The doctors ask that we carry My Girls. It's an absolute amazing cream for radiation. Then we just have more fun things here. We have some jewelry. This is a brand new line that just came in, and it smells fantastic. So I'm anxious to introduce this to our patients.
Hey, Judy.
Yes.
Judy. So Missys is an
Yes.
accredited. Missys is an accredited boutique. What does that mean for a patient or for a customer?
Well, we are so proud of being accredited. What happens and what this means to the patient is our fitters here and the people that work with patients are held at a little higher standard. And so they come in about once every 3 years and they drill us all day long. It's very intense, but at the end of the day, we know we are the best and we can offer the best to our patients.
That's good to know. Okay, so I want to talk about Lori's story because it makes me think about what a lot of our cancer doctors here always say, that cancer doesn't care about COVID, it doesn't care about pandemics, it just plows on through. So tell me how this pandemic has changed the way that you serve your customers. You actually said that there were some good things that came out of it, right?
Yes, absolutely. One thing that has come out of it is that we have been able to take the fear of the COVID out of the equation. And by that, one of my fitters, when it was in our dark days, said, you know, this is ridiculous. This is a safe place to come. We follow policy and guidelines. We've been educated on the COVID. We know how to deal. And so she started calling all the patients that were on our schedule for the 2 or 3 months and letting them know that it was safe, that they could come and feel safe. And after that was done, they started coming, and they have kept coming. And now the last 3 months have been some of our biggest months, seeing patients that we've had in a long time. So we're on the move forward.
So we're going to put information about the patient education classes up on our Facebook and our YouTube feeds. There's some information right there. It's every third Tuesday from noon to 1, and all people have to do is just register, right, Judy?
Yes, that's all. One thing I found, we've been working for a long time on being able to present classes to our communities, and this is a great outreach way to do that. I have found that our Zoom patients are coming in. I get all kinds of remarks. One of them that really made me know that it was going to be a success was one of the patients said, I had no idea there were different bras for different types of surgeries. And so we got whatever you need, and you're more than welcome. We want to serve you. You can depend on our loyalty and our service here. So please come.
All right, Judy, we're going to continue this conversation, and I know we're going to have some questions from our audience here in just a moment. We've already got a few comments coming through for you here in just a minute. Dr. Stites, I just want to bring you in because I know when you're, handling patients and, your CF patients and families, how important is community support, places for people to go in their overall treatment? I mean, the mental aspect of it and just their overall healing. What have you found?
One time I was sitting in a CF meeting, and cystic fibrosis used to have a mortality rate that was extraordinarily high. And when I started in CF, the average life expectancy was about 16, and it's gone up. It's still young. It's still 40, but new therapies are going to really push that advance much further out. We used to say at the meeting that it was 50% science and 50% pep rally, and the pep rally was more important. And I think for patients, that's the same story. Trying to heal from a difficult disease is 50% science and 50% pep rally. And where do you find that support? Where do you get it from? And you can get it from your patients, or you get it from your families as a patient, but you really need it from the healthcare team. And I think this is a great example. Missys is a great example of just that. We have to take care of the whole patient and not just the disease. Mm-hmm. If you don't, you're going to miss half of the treatment plan. And if you miss half the treatment plan, patients don't do very well. And I think that's something we probably don't talk about enough in medicine. In CF, we have a team of people, right? We have a dietitian, we have a social worker, we have a therapist. We have people who are really geared to taking care of people who thought they were going to die from the day they were born. And I think the same thing's true. You get that diagnosis of cancer, and it scares you. When I was diagnosed with prostate cancer, it scared me. And, who takes care of you then? And I think one of the great things about our cancer program, and again, I participate with that program, is that is a great team of people that that are on a mission, and that mission is to support you. And for them, every day is the Super Bowl. Every day they have to come and bring their best game to it. There are no down days. You're not supposed to be throwing the interceptions. What you really want to do is be there every single moment of every day to take care of folks who you need that pep rally as well as the science. And together when you do that, you can offer great patient care. But I think it's the whole story. You got to take care of the brain, you got to take care of the body, you got to take care of your total health.
So you received the pep rally when you were going through your cancer
diagnosis. You bet.
And then I'm sure you have had to be the pep rally for your patients and their families.
Absolutely.
What's that like for you?
Well, first of all, my mom died of lung cancer, so I've had direct personal experience plus my own experience. And then I think one of the things that you realize as a physician, and I think as a care team, is that the emotional connection of that patient with you is again, it's just as important as everything. I mean, I have a couple of patients right now who are struggling with a couple of things, and you're on the phone with them frequently. You're talking to them about what's going on. You're trying to help answer their questions, but it gets back to that. I am a sports freak, but to get back to that term from the field of dreams, ease their pain. And I think that's part of what we have to do. We have to do more than try to treat their pain. You have to ease their pain, because what people really want is they want a little bit of hope. Even as they're dying, they still want hope about what that's going to be like. And I think if we can help with hope and compassion and science, we've often said that the key to cancer therapy, or to the COVID therapy, was faith, hope, and science. Mm-hmm. And I think you could say that about cancer. I think you could say that about CF. I think you could say that just about anything. You need faith that the people around you care about you, and for me, faith in God, and then hope that there is something that's going to be good for you along the way, and then science. So you have some faith and hope that you're going to get better. And I think really Missy B's is about, to me, it's about that science and the pep rally put together to have people have faith and hope.
Really well said. I just want to take a moment to shout out to all of our YouTube viewers today. We've got a lot of them watching on YouTube, because now you can find us on Facebook and YouTube. So I just want to say hey to all of them.
Welcome aboard. YouTube TV, baby.
Right.
There you go. I could do that. I could get on YouTube TV. It's pretty remarkable.
You are
I think
viral.
my kids are astonished.
Are they?
Well, they helped. They're still astonished.
They are, just in general.
I astonish them every day. Yes, I do.
So I've got some questions coming in. I know our community has some questions. They've been saving them for over the weekend, and we've got
build
some.
them up.
I know they're building up, so I'm just going to get to those really quick. I do have one. Joyce wants to know, Judy. Joyce wants to know if people are vaccinated when they come in. I don't know if all cancer patients able to be vaccinated. What is that like when they come into your store?
Well, the majority of our patients are vaccinated, and the reason why I say that is because they have to go to registration before they come in to see us, and then we, on the schedule we receive each day, will let us know. But we are prepared.
So
everyone is welcome.
Okay, you're taking the precautions.
Yes, we are, absolutely, for ourselves and for our patients.
So I have a couple of comments for you, because Georgianne and Judy both had a wonderful experience with you. Okay. Georgianne says, I remember Judy. Missys is wonderful. She got her wig there. Wonderful, sensitive people, wonderful selection, even if you're not in treatment. And I think I was talking to you last night, Judy, saying I think you probably have a lot of best friends. I think people walk in there and walk out just feeling better when they walk in. You kind of had a special story about that, right?
Yeah, oh yes, absolutely. We have many stories, but one of them involves our vice president of the Cancer Center, Jeff Wright. Many years ago, we had a patient come in, and she went into the wig room, which is probably the beginning of her journey, so it's the most fearful place to start. Well, she brought in 12 of her sorority sisters with her, so we all crammed into the room. So anyway, it was pretty dark and people were depressed, and I said, hey, come on guys, let's make this have some fun. So I took the clippers and I said, we're going to pass this around to each one of you and I want you to take a swipe. So I mean, that hair looked every which way. I finished it off for her, but there was so much laughter and people having so much fun. When Jeff walked by the boutique, he had to come in to see what was going on. He said, I can hear laughter all throughout the Cancer Center, and that's what happens in here. There are people that come in that are depressed, but they leave with a smile on their face and confidence, and that's what we create here.
I know.
That Jeff Wright's a pretty good guy. I
Yeah.
played flag football with him. He was at the football game last night. I asked him if he could go down and play defense.
He would actually be able to help.
I thought maybe he could help a little bit. No, Jeff Wright's a good guy, and I think he has been a terrific leader. He and Terry Sue have done a terrific job. down there in the
They
cancer
do.
program.
They live and breathe that cancer center. And so I envision Missy's being like this little beautiful corner of the world, and all this like loud laughter coming out down the halls, and just people wondering, what is going on down there, and you're just changing lives and being there for everyone. I have a really good question from one of our YouTube viewers, Jerry. He says, and I'm so glad he asked this because I was going to get to this, but he says, I know a man who had breast cancer years ago. He lived after the treatments, but his question is, does Missy have items for men who have breast cancer? And where do you send men when they have questions?
No, we welcome anybody that has breast cancer. I have to tell you, probably in 12 years, we've only had one man with breast cancer, and we shaved his head and fit him for a wig. But we are equipped to handle that, and we welcome that.
I have just switching gears really. Go ahead. No, go ahead, Judy.
No, I wanted to tell you one other quick story, if I could.
Yes.
About Missy's. We had a patient come in. She was a patient in need, or a PIN patient. And she was so upset because she really didn't have any finances to get the items that she needed. But because of our fund here, we was able to help her and give her the items that she did need. But after I finished fitting her, she just bowed her head. I thought maybe she was praying, but she was in deep thought. And when she looked up, this has always stuck with me. Her quote was, Missy's is like the Hope Diamond. You can't put a value on it. And I truly feel that is true. She summed it all up.
Mm-hmm. And I think we agree. Thank you for sharing that story. I do have a couple of questions about the pill. Dr. Stites and Dr. Hawkinson. Isaac says, as far as the antiviral pill, what does the effect profile look like as far as side effects? I know you mentioned that a little bit.
We don't really know enough about it yet, and that's part of, to your point, Hawkeye, we haven't really seen the data. We don't really know all the side effects of it yet. Merck says it's safe, but they haven't published the information. Until they publish the information, we really won't be able to comment as well.
Yeah, I completely agree. The earliest studies that are done in any drug development is really the safety study. So the only thing we have to go on is that their later studies look good, so we have to assume the side effect profile looks good, but we haven't seen it completely. And once they are able to submit that data to the FDA or make it publicly available, we'll be able to take a look at it.
So Hawkeye, why is it that you have on a dark shirt and no tie? I have on this white shirt, which makes me look like Casper again. I did wear a tie though, and you didn't have a tie. I got to follow your dress code better.
Jill
I
told
got to
me
do a better
early
job.
on, don't wear the white shirts
I
and the white
know.
coat.
I did bad on that today. Okay.
Oh, I like that tie. It looks a little chiefy.
Well, it was meant to still show some chief colors and be a little, to be a little supportive of
Is
the
it
team.
to wipe your tears?
Yeah, I was upset last night. I couldn't go to sleep for a while. My wife was like, "Okay, I'm going to bed, but I know you're going to be up for a while."
Right.
I have to decompress from a loss.
Okay, I do have a question, and I'm probably going to mispronounce. This is where my mispronunciation comes in. Lindsay wants to know, with Pfizer being approved by the FDA, what is the difference between Pfizer, BioNTech, and
Comirnaty. You did good. I actually looked it up.
You did?
We saw that question when the camera was talking to Judy. I was like, I'm going to get this pronunciation
And then
right.
he passes it across the desk to me, and then I spew it out like I know everything.
Comirnaty.
Comirnaty.
Well,
So what's
it's
the
funny.
difference?
Well, there's this whole internet stuff going around like Comirnaty is not what they said it was. It's a different drug and blah, blah, blah. Nah, it's just baloney. All the time, drugs come out, and when they're studied, they have long study names. And, Pfizer BioNTech actually is a bunch of initials and numbers. And then when it's released, it has a product name. And the product name is approved by the Food and Drug Administration. And the company they work through all sorts of marketing and stuff like that to figure out, what do we want to call it? And they come up with Comirnaty. And I'm not quite sure. Maybe it sounds a little bit like coronavirus and community. And I don't know what things they're trying to go for. But Comirnaty. And the reality is there is no difference. Don't listen to the internet memes and all this stuff. There is no difference. It's the same drug. It's manufactured in the same manufacturing plants that the FDA inspected as part of their approval process. Remember, the FDA doesn't just look at safety data and approve a therapy. The FDA goes and inspects the plants. They look at the manufacturing process. They look to make sure it's safe, that there's no quality control problems, that the manufacturing is within a very tight, narrow range. I mean, there's a lot that goes into a drug approval. And so Comirnaty is nothing but the product name Hawkeye for the drug itself.
Yeah, we saw this come out early on. I think it's either a conscious effort, this misinformation campaign, or just not knowing and understanding. But certainly there is I can't remember if it was a CDC or FDA or World Health Organization brief that also said this is the same exact product. So this is just, mostly this was a misguided misinformation tenet that some people were building on, but it's absolutely not true. It is all the same product.
And hey, Hawk, just to say, there's probably a really big news cycle that's going to hit at the end of this week around vaccination.
Yeah.
First of all, Moderna is going to get evaluated on Thursday by the FDA for their booster information, and on Friday it's J&J. And we expect sometime in the next 1 to 2 weeks that we're going to hear about Pfizer vaccine in 5 to 11-year-olds from the FDA. So there's a whole lot of information that's going to go on in vaccination. I think it's going to be really important. We'll stay tuned. I know we're going to be talking about it, but I'm excited to see how the outcome goes with Moderna and J&J discussion. I'm excited about the Moderna data. Looks really good, even at 6 months for illness and death, and so it'd be interesting to see what that booster shot looks like.
Yeah, I'm speculating, but I think because we have already heard about the confusion and the messaging, whether it's about masking and how to do these non-pharmaceutical interventions at any particular time, whether it's about vaccination, whether you're immunosuppressed or not in boosters, and there are certain groups with the Pfizer that are recommended to get an additional dose, but there are other groups that may get an additional dose. So, maybe out of ease, I'm speculating, and I just suspect both Moderna and Johnson & Johnson will come through, and it'll be just like Pfizer. But who knows?
I think
we'll
you're
wait
right.
to see.
I'm going to speculate the same because I think they're going to go for ease of communication. Even though it may not be the perfect science, like ease of communication. And I think there's something to be said for that.
Yep.
So,
Becky wants to know, do you think this pill, the Merck pill, will keep people from getting vaccinated?
that's a fear some people have. But here's what I think that those people who are being really resistant to vaccination don't need another reason to be resistant to vaccination. And you have to remember that a 50% reduction is not the same thing as a 95 to 98% reduction, right? It is still much better to be vaccinated, because the other thing that we don't know about is whether or not if you're taking the pill, you actually if you decrease the risk of spread. And we know clearly that even with the Delta variant, that any one of the 3 vaccines appears to reduce the risk of spread as well as help you prevent getting the disease. You can still spread it, but your odds do go down. So I think that the pill is a good thing. I hope it doesn't. I do have some fear that it will.
Yeah, and I would also. So my fear with antivirals is always the development of resistance. But more also to the point is we do have early data signals that vaccination helps prevent or decrease that risk of long haul or long COVID. I don't know that this would be true for the pill as well. So I think
point.
those are questions that will be answered as you get into any post-marketing continued analysis looking at the total continued positive effect or benefits, and then any other risks that may be later, such as reducing that COVID risk.
So I want to head back out and talk
Or
about
the long COVID risk, I'm sorry.
No, you're fine. I want to head back out to Judy and at Missy's Boutique. I have a couple of comments for you from some of our viewers, but Greta says that Judy is an angel here on earth. I think that's been established. Another Judy says that the Cancer Center took great care of me, right down to scheduling me for a consult at Missy's before my surgery, right along with all the other consults, because we know that there's a lot of places you have to, so many phone calls you have to make and things you got to get set up. So this is just one thing that was off of her plate, which was really, really nice. And then a question came in about, and you mentioned this also, that you take care of everyone, Judy, but Rita says, do you have to be a patient of our hospital or our cancer center to come to Missy's and to get fitted or to be seen?
No, that's a great question, Jessica. There are no boundaries here at Missy's Boutique. We serve all communities. All people are welcome. We have a nice PIN or patient in need fund for those patients that are uninsured or underinsured. So everyone is welcome. And we encourage that through our Zoom classes or through media spots like this. We want to get out to the community to come. Please let us help you. One thing I would like to stress, breast cancer strikes at the core of a woman. Her appearance is critical. And when you have the right mastectomy fitter, learning that patient's lifestyle and her physical needs, she can be fitted with the right items. So when she looks at her silhouette in the mirror, she can turn and a smile will radiate on her face as confidence. And that's what we achieve here. And I'm so proud of all my staff because they're all winners. And most of them are also breast cancer survivors, so we do relate.
It's a big deal, just to say, and Judy, I think you guys do, I know you do great work. I've sent a number of patients down to see you, and I do think, again, it is faith and hope and science, and this hope means everything. And I also just want to say, I love the pink mask on the mannequin behind you. It fits in. The color scheme is perfect. That is so great. Well done.
Yeah.
Well done. And I assume that the
Yeah,
mannequin's
thank
been
you, Dr.
vaccinated
Feist.
as well. I'm sure it's vaccinated.
Well,
That's good.
hey, everybody has.
Well, I'm glad you brought that up because I asked Judy last night when I tried to call her before the Chiefs game started. I said, I'm sorry I'm calling you. I know you're probably getting ready to sit down and watch the Chiefs, but I wanted to talk to you a little bit about Missy's. But that you can just walk in as a consumer if you want to buy a gift certificate or an item for somebody who's going through breast cancer. Tell folks about that.
Absolutely. Like I said before, we have everything a patient needs or a shopper. Some shoppers will come in and they have a family member or a friend that is struggling and they have needs for products that we have. So they will buy a gift certificate and send it to that patient. And so, yes, we do welcome those shoppers also.
Well, I've heard that before. People have a friend or a family member going through an illness and they go, I want to do something, but I don't know what. It's all new to them. So I love to think that somebody can just come in and you'll help guide them. I said it off the top of the show. It feels like you're necessary as part of this whole treatment process from the beginning to the end. So I want to ask you too, do people need to make an appointment? If you need to get fitted for bras and wigs or a haircut, what's the process for that?
Well, we do prefer an appointment and a script from the doctor. And the reason why I say that is because in the beginning we wasn't that busy. Now we're very busy and we like to stay on schedule, help as many people as we can. So yes, an appointment is important. However, there have been patients that have just walked in the door. We explain to them that we are on a schedule, but we will work them in if they don't mind waiting. So we hate to lose anybody, but most patients are here anyway, week to week, and that's not a problem. They're always happy to schedule an appointment.
I've got a couple of questions. Mary and Christy both asking, does Missy accept donations? can you donate? And somebody asking about the PIN fund, PIN fund.
Yes, I love that question. and yes, absolutely, we take donations. All of our donations go through our fund development department. However, if you want to make a direct donation here, if you tell me where you want it to go, like our patient in need fund or our operational fund, then I will make sure I will hand deliver it to our fund development department. So yes, we do take donations, and we do that often. And it's for those donations that keep the doors going and open here, because we are not for profit.
Quick turn to COVID. Dr. Stites, Dr. Hawkinson. Lindsay says, I have 2 young boys active in sports, ages 6 and 8. With the vaccine, myocarditis risk, is it higher for boys? Should I have them hold off on strenuous activity in sports after vaccination when they are able to get it?
No. From what I also understand is, the highest risk for developing vaccine-induced myocarditis, which again remains overall rare, is that older age group of boys that are already okayed and eligible for the vaccine. Now, again, we haven't seen the full data set from the younger groups, but I don't think there's any indication, and there certainly is no guidance, even in those adolescents that have been vaccinated, that you need to hold them back from any activity at this point.
Okay, a couple more questions, Judy, for you. Do you sell prosthetics for women who do not choose to have reconstructive surgery? Do you fit for those?
Yes, we do. We have all kinds of breast forms, and that's why it's so important to get the right mastectomy fitter with the right education that will know what that patient needs. But we have enhancers, we have expanders, we have whatever the chest wall and that patient needs, we can do that for them.
All right. Well, we're going to get to
related to the chest.
Okay, good. Okay, covers it. All right,
it.
so we're going to get to our final thoughts, and Judy, I'm just going to stick right out there with you. First of all, just thank you so much for coming on. I think we all learned something today, and I know our viewers are happy to see your face. So many people recognize you, and we're just glad that you're here in our community and helping these women and men if they need it. So, just what is your final thought today? What do you want us to know as we head into our week?
Well, first of all, I want our doctors and nurses and our different departments here at the hospital and the cancer center to know that part of our success is due to them, because they're so willing and they trust us with their patients. And I think we have created a great bond, and for that I thank everyone.
Thank you, Judy, for coming on. We will see you again very soon. Dr. Hawkinson, your final thoughts today.
I think just like Dr. Stites said, we do see some information coming about an oral therapeutic after you get COVID, but the best prevention, the best thing to do to reduce your risk of any of these complications and long-term problems is certainly continuing the non-pharmaceutical interventions, and of course vaccination. Reducing your risk of all of these things by getting vaccinated is still going to be the best bet. And again, in the next week or so, we should have more information for those of you that did get Johnson & Johnson and Moderna as well.
Dr. Stites, I'm going to let you have the last final thought, but I do just have to read a couple more comments. Denise says, I've been to Missys, and I've been blown away by the boutique feeling. It feels like you're in a Victoria's Secret, not inside a hospital. I love that place. And Subini says, survivors deserve to feel pampered. So I just want to let you know your reach is out there. People know you. They love you. And Judy, you're doing such great work. So just want to say thank you again.
Thank you. Thank
Dr.
you.
Stites.
That makes me feel warm and fuzzy.
Good.
Judy, you should, because you do great stuff, and our patients deserve that sort of that support. It does take a community. And I just have to say, I think the best news that we've had today, outside of Judy's great work at Missys, is, and even if you're in Buffalo, you got to believe this right now, that the best news is the fall in the number of new patients that we're seeing. That is just great. That's the result of people getting vaccinated, people wearing masks, and unfortunately, people getting a lot of Delta. Remember that protection doesn't last forever. You still need to get vaccinated in the long run. You have to trust the science, which is what delivers on your faith and hope. That's what's going to keep us all safe. And that's what's going to let us be back opened up the way we want to be. And then we won't have to see pink masks on mannequins at Missy's. That will be the best.
Great message. I love it. Thanks, Dr. Stites, and thank you all for being with us today. Tomorrow, as we continue to observe Breast Cancer Awareness Month, tomorrow it is a special milestone, the 100th patient to receive an advanced cancer treatment. It's called intraoperative radiation therapy, or IORT. We're going to take you live inside the operating room. And again, we're going to talk about why screening and early detection often allows for way more advanced treatment options like this. So have a great day, and we'll see you back here at 8 a.m. tomorrow.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.